Hi, welcome to EpiCentre Seminar Series, the first of this year. I'm Jun, a research officer in EpiCentre. Today's speaker is Dr. Katja Isaksen. Katja is a veterinary nurse and works as a veterinary laboratory animal technician from Norway. She originally joined EpiCentre in 2016 as a PhD student to study health and welfare of working dogs in New Zealand. After graduation, Katja worked for the Ministry for Primary Industries for EMBOVIS project, and last year she returned to EpiCentre as a postdoctoral fellow. Today, she will talk about the types and incidence rates of health events that were reported from search and rescue dogs involved in 9/11 terrorist attacks in New York, USA. Katja, you can start.
Okay, thank you. Okay. Do you actually see just the slide now?
Yeah, good to go.
Good. Thank you. Okay, so move all of this stuff. Okay, so I've been working on a project with the University of Pennsylvania where they recruited dogs. After 9/11, and they've been following them. So I'll give you a bit of background to the project, show some of the previous publications that have come out of this, and then run you through the current study that we're working on with some implications of the results and where it's going to go next. And throughout this, I've just put in a bunch of really nice photos that Cindy Otto took during the 9/11 response, because she was actually one of the responders at that point, and she was a vet working for one of the agencies. She's now currently the head of the Working Dog Center at Penn Vet, and she's the one in charge of this project. After 9/11, about 250 to 300 search and rescue dogs were deployed, both to the main Twin Towers site in New York City, to the Pentagon site, and also to the landfill site in New York, where they brought all the building materials, because they brought the building materials there to be searched for for cadavers, basically. And because of all of this, there's a lot of debris, there's toxic waste, there's asbestos. Humans on the sites were given personal protective equipment, but obviously dogs weren't. So there was a lot of concern that they might be exposed to dangerous materials that might impact them in the years following that. And previously, there had been some examples of dogs acting as sentinel species for their handlers, that they might develop diseases quicker than humans. So there was a few reasons why they wanted to follow these dogs. So they recruited 95 of the deployed dogs, and then 55 search and rescue dogs that weren't deployed to 9/11, and followed them from that time until their deaths. They were interested both in physical and medical incidents and issues, and also behavioral problems. So there were yearly questionnaires from 2001 until the dogs died, and the last reported death was in 2016. At the beginning, they also did blood sampling, x-rays, and a few other things, and they also interviewed the handlers about psychological issues and a lot of things that isn't part of this specific study, but it's a part of the larger project. And this all captured a lot of long-term health data about search and rescue dogs that had never previously been recorded. And really, it hasn't really been recorded in dogs at all. There have been some longer projects, but nothing at this scale. So previous papers that have come out of it has been about the medical surveillance, some of the pathology and toxicology, and also some papers on behavior and welfare. And I realize my camera is in the wrong place. Anyway, so they found some differences in blood values at the very beginning, but nothing that was out of reference ranges between the deployed and the non-deployed dogs. The dogs that had been to 9/11 were more likely to have some abnormalities to their hearts on X-ray, but again, there was no evidence of differences in diseases. Some dogs, they were able to do necropsies after they died, and dogs that had been deployed were more likely to have particulates in their lungs, but again, there was no evidence of more disease or like differences in causes of death. Psychologically and behaviorally, both dogs and handlers were quite resilient. There wasn't a lot of problems. There wasn't a lot of depression or PTSD in the handlers, and very few behavioral changes long-term in the dogs. The only thing they did find was that if handlers generally had more symptoms of depression, the dogs were also more likely to have more illnesses and behavioral problems. But generally, no major effects of the 9/11 deployment was found. And the project is quite useful in that way because it shows that there was no major impact for this one event. But it's still interesting to follow search and rescue dogs throughout their lives because you can find information that you can't find in any other way by following them over time, and nobody's done this before. So they were hoping to find what kind of diseases these dogs are likely to get, and if there's any differences with pet dogs or other types of working dogs. So that's what we're working on at the moment. So the current study, we were looking at medical events that were reported by the handlers in the yearly surveys. And we had 682 surveys that were submitted over a 15-year period. And we wanted to summarize the types of health issues just to see what was there. And we calculated incidence rates for the most common types of body systems that were affected and the types of conditions. And then we looked at whether there were any differences between like sexes, breeds, and deployment status, and also for neutering for the most common body systems. So what we found was that 64% of the dogs had at least one reported health events. So remember that these are not the number of health events themselves, it's the number of dogs that had at least one reported. Because it's difficult to know from year to year whether something is the same disease or whether it's a repeated like a repeated record of the same thing. So it's much easier to just count the number of dogs. We found that the musculoskeletal skin and gastrointestinal system was most commonly affected, which is very similar to what's seen in other dog populations. And for incidence rates overall, about 29 out of 100 dogs per year had some kind of health events. Musculoskeletal had the highest incidence was for musculoskeletal abnormalities, followed by skin and gastrointestinal again. And the incidence rates were not affected by sex, by neuter status, by breed, or by deployment at 9/11. So for the musculoskeletal health events that were seen, they were most commonly recorded to be a degenerative joint disease, soft tissue injuries, or sort of unspecified pain and swelling. Skin conditions tended to be trauma, infections, and different types of growths and tumors. And the gastrointestinal issues tended to be inflammatory. Anything just inflammatory diseases, anal gland problems, that kind of thing. So nothing that really stands out as very special for search and rescue dogs, which is interesting in itself. But musculoskeletal problems are obviously a problem, as they are with other types of dogs. So implications of this, this is the first, like I was saying, this is the first study that has followed search and rescue dogs through their lifetimes. And what we found was that participation in specific responses are unlikely to have any long-term health effects that we could find. And there's also no evidence from this that sex, breed, or neutering had any strong effects on these common types of health events. But, this is quite broad and quite, like we haven't specified, like we haven't gone and drilled into very specific things. We just looked at the very broad categories because our sample size wasn't that big. And also there's a lot of non-responses through the years as dogs either die or handlers, they don't respond to surveys, or, a lot of different things. So, there's a limit to how fine a net we can throw at this data, basically. But we do learn quite a few things, and mostly I think the lesson is that they are very similar to other types of dog populations. Like they're very similar results that we found in working farm dogs in New Zealand, that people have seen in guide dogs, police and military dogs, and in pets. And it's also interesting that the results stay similar over a very long period of time, and not just for, one-time surveys, which is what most of these studies have been before. So next, we're going to do a very similar analysis of surgical treatments that were done in the same dogs, reported through the same questionnaires. The Penn Vet Working Dog Center will definitely continue to focus on preventing musculoskeletal disease and injury, and they have a very interesting program which they call Fit to Work, where they have basically a physical fitness program for the dogs that they themselves train, and they keep that up during the dog's life, and they're hoping to gather data and see, hopefully, that this will prevent musculoskeletal disease through their lives. But it's still in the early stages, so we don't really know yet, but hope. And generally, you just, for search and rescue dogs, you just have to ensure that the handlers are very well prepared, that they know about prevention and first aid for injuries, that they know to prevent disease through vaccinations, that they're aware of environmental hazards, and that they do this both in training and on deployment, and that they do it throughout the dog's life, and ensure to keep them healthy. So that's basically my presentation, and I wanted to acknowledge basically the handlers and dogs, the guys at Penn Vet who have done all the hard work and gave me the data to analyze and work with them. And they had some funding from the American Kennel Club and the Working the Dog Research Forum. So I thought I should include that. And I have a long list of references of papers associated with this project if anyone's interested. So yeah, any questions, you can let me know.
Oh, thank you, Katja. As Katja said, is there any question? If you're uncomfortable being recorded, then you can just type your question on the chat group so that I can repeat.
Can I ask you a question, Katja?
Sure.
What sort of statistical methods did you use when you analysed the data?
Very simple. We just did just incidence calculations from basically from 9/11 until their deaths, or the last record we have of them. And then just looked at the risk factor, mostly just risk ratios, and they wanted to have some p-values. So I think I did I didn't think I did the Fishers, but I don't remember right now. I'm sorry.
Okay, I just wondered whether you considered survival analysis methods in this kind of data, and if you kind of looking as though you weren't all that keen on that, but just wonder why, because it would seem kind of a fitting, at least from my distant view, quite a fitting kind of setting to apply survival analysis methods, and it may be more precise, if you like, or more sensitive to the rate at which animals are being diagnosed or are leaving, and account for those animals that are leaving the population due to loss to follow-up.
Yeah, I think problems is mostly about how many holes are in the data, because dogs would sort of fall out and come back, you know, miss a few surveys and come back, and then, you know, it makes it harder to analyze, and there's only about 150 dogs altogether. So I think we didn't really discuss it, but I remember we had a conversation with Naomi about that on my farm dog data, which was a shorter term, but probably, you know, more fine masked than this. And we ended up not doing it there because there were too many gaps in it. So I don't think this would have been any better.
Good, thank you.
And if there's no question, then can I ask one? So wasn't there any case that the handler was changed during the course of the study? Like,
no, as far as I know, all of the handlers are actually the dog owners. So it's people who have dogs that do search and rescue on their free time mostly. So the dogs are mostly pets most of the time, except when they go out and train or they go on deployments. So they're not really the same as like police or military dogs like that. They're a lot more, well, unorganized, I guess.
okay, thank you. Any other questions? Okay, if not, then thank you, Katja, for your great presentation, and thank you all to spend your precious time to join our EpiCentre Seminar Series. So next one will be in May, end of May, and I will let you know when it'll be and what it will be. So until next time, thank you, and see you guys. Bye.
Thanks for having me.